Hi, welcome everybody. It's me, Dr. Khaled Sadek, and you've tuned in to another episode of my global virtual clinic. For those who are new to the channel, welcome. I'm Dr. Khaled Sadek. I'm based in London, and I specialise in the treatment of cysts and lipoma, which are benign skin conditions that can cause a lot of discomfort, maybe some deformity and infection. So if you would like any information on the removal of cysts or lipomas, then please check out my website, lipomacyst.com, for more information on how you can seek me. I've also dedicated my entire YouTube channel showcasing some of the work that we cover on lipomas and cysts. If you're new, if you're well versed in the channel, then welcome. As you know, today is our Sunday virtual global clinic where we field questions from our viewers from across the world. We talk about the videos that we've released in the past week. We talk about the video that we're going to release next, and we also do a shout out to all of our viewers. So let's start by talking about the last video that we released. Now that was a really large epidermoid cyst. It's been on someone's scalp for many years, and I was at two minds of releasing it because one, it was a complicated extraction and it was quite gory. So we did release it. There were some technical issues with the editing, but we released it as also a celebration of our YouTube verification. So we're now a verified YouTube channel, which demonstrates the quality and authenticity of the products that we're showcasing online as a trusted source of medical information. So it was our longest video at 25 minutes, I believe. Very controversial, lots of people commenting. Let me know what you thought about that particular cyst. In the next video, we've got a very common presentation, and that is an epidermoid cyst or a sebaceous cyst right on the back. Now, this is a young gentleman who wears a shirt to work, and obviously having that disfigurement present is not something you wish to bring to the workplace. So I see a lot of people who are very reluctant to have these simple procedures because of the unknown, and they struggle with these deformities, these infections for many years. And I hope that this YouTube channel will provide information on how simple these procedures are and how easy it is for you to seek treatment. So let me begin by saying hello to everybody. So we're going to scroll through. Remember, if you've got questions, any medical questions about any topics, then please ask them in the comment section. I thought I'd kick off discussion today by discussing osteoporosis, because we had one of our viewers who wanted a bit more information on osteoporosis. So I thought, well, we can do a quick rundown of osteoporosis as well as take some questions. For those of you who may or may not know, osteoporosis is the thinning of the bones. Now, the skeletal system is a vast network of structural support for the body in which muscles and tendons and nerves and blood vessels all build themselves around. Our skeletal system develops from a young age, from when you were children, and the bone is constantly growing and rebuilding. That rate of growth and rebuilding is always in a positive balance up until about middle age, at which point we end up having more bone reabsorbed than we are producing. So we end up getting into a negative state. And there's many reasons for that. For first and foremost is lifestyle. So if you were to have a high impact youth, then your bone mineral density will be nice and strong, and your reserve going into sort of the second half of life would be relatively unhindered. But if those of you living more sedentary lives, or those of you who have a family history of brittle bones or osteoporosis, then you'll be at a disadvantage of developing osteoporosis. Secondly, there are many conditions that are associated with increased blood thinning. For instance, thyroid disease, people on long-term steroids, alcohol consumption, and certain other medical conditions like kidney disease and bowel disease. We also know that osteoporosis is much more prevalent. Hormonal changes of menopause can adversely impact the onset of osteopenia and osteoporosis. And we also know that HRT treatment can sometimes reverse or reduce the rate of absorption. So what does it mean? Well, if you're suffering from back pain, or you've had a light force fracture, then it's most likely going to mean that your bones are a little bit thinner, a little bit weaker than they would have been previously. And one way of finding that out is to undertake what we call a Dexa scan. Now, a Dexa scan is basically a bed on which you lie while a very skeletal system. This roadmap will be able to tell us which parts of the body are particularly prone to fractures, i.e. we get a score based on how strong certain parts of the bones are. In medicine, we're interested in a number of places, and that includes the spine, in particular the lower part of the spine, known as the lumbar vertebrae, as well as the neck of femur, which is the hips. So if you were to have a fall, you're most likely to fracture your hip, especially if your Z score, that is the number that's given to your osteoporosis level, is much, much lower than otherwise expected. How do we prevent osteoporosis? Well, you can obviously take vitamin D and calcium, because the sunshine vitamin helps to strengthen bone, and the calcium combined will help to rebuild that structure. There are also more aggressive medications that are prescription-only medications known as bisphosphonates, which are there to try and stimulate the cells that produce calcium to increase in the bone, and therefore strengthening the bone structure itself. However, they're not without their faults and also controversial. So I hope that was a quick overview, quick 5-minute overview of osteoporosis and osteopenia, as one of our wonderful viewers wanted to ask. So if you've got any questions, then don't forget to ask either in the live chat or in the comment section below. So with no further ado, let's have a look who we've got in the house, and let's take some questions. I'm going to scroll right up to the very top. You know the routine. We give a shout out to our top 3 podium position. That's a shout out to those individuals who have managed to log on very, very early and get their comments in a top 3 position. So Louise Cook is number 3. She says, Dr. Sadek, could you add thyroid disease to one of your clinic sessions, particularly dry skin, sweating and itching? Louise, that sounds like a wonderful suggestion. And let's do that on Wednesday. Our next global chat will discuss thyroid disease in a lot more detail. We'll cover the skin issues, we'll cover the energy, we'll cover the weight gain, the hair loss, how to treat it, overactive thyroid, underactive thyroid, goiters, and much, much more. So Louise Cook will be covering thyroid disease on Wednesday at 9:30 Greenwich Mean Time. That's 1:30 Pacific Time, 4:30 Eastern Time next week. In at number 2, we've got Rhonda Burke, and she's wishing everybody a massive hello. And in at number 1, we've got Bridget Schumacher racing ahead there at the podium. I can see Sid G as well. Another hot day in Atlanta, Louise is telling us. Today she had a wonderful restaurant brunch and she wished everybody could join her. That's awesome. Welcome. Patricia Webster, hello. Rhonda Burke is saying she's in Lawrence County and it's cool and it's wonderful to see everybody. Alessandra from Sao Paulo. Alessandra sent me a wonderful, lovely email in which she quite beautifully wrote how the channel helps people with disfigurement seek treatment. And that is actually part of this program, is to really spend my time in making people aware that you don't need to kind of walk around with large lumps and bumps, disfiguring you, knocking your self-esteem and confidence. This channel hopefully will provide that information to kind of, you come in, you see me, you can see what the doctor's like, you can see what the procedure's like, and hopefully that barrier, that stigma of getting it removed is removed. And hopefully one video at a time, we can remove lumps and bumps all over the world. So Alessandra, thank you so much for sending that email. It was beautiful. I will try and share it on my Instagram. It was so nice. Denise, how are you doing? In Edmond, in Washington, it's 67 degrees. It's shady and sunny. Awesome. Hit the like, everybody. If you haven't hit the like, I don't know what you're doing. 26 people haven't hit the like yet. Sherry is reminding everybody. Caroline Steed from OKC, Oklahoma City, welcome. Sula Lally, she's hit the like from London. Denise Bond hit the like. Dr. Sarah, our orthodontist, has hit the like. Kelly has hit the like. Belinda Mao, doctor, has hit the like. George W. has hit the like. 22 degrees Celsius here today in southern Ontario in Canada. That's not a bad day, not a bad day. It's really cold in England today. I think the central heating is on. Orange G, welcome Orange G. How are you doing from Houston? Hope everything is going okay in Houston. Welcome. Margaret Brace, she's logged on for a Sadeki session. Gail Sharp from East Texas, 75 degrees Fahrenheit for George Ford. Shannon Clay is wishing everybody a wonderful day. Did you ever find out about smelly hair syndrome? You know, I looked into it, Belinda, and the information I found wasn't as strong as I'd want it to be. So why don't we try and piece it together, and we'll combine smelly hair syndrome with thyroid disease together, because there may be a link that we're missing there. So let's join those two together for Wednesday's session. Joanne Burke, How are you doing? It's 62 degrees. Welcome. Rhonda I. Clark Allen for Arkansas, United States of America. Welcome. Rosemary Ross saying hello, everybody. Terminator T800. Welcome on board, Mr. Terminator. Or is that Mrs. Terminator? Jane White from Georgia, United States. Bright, sunny, smoky. Dodging fire in California with a little COVID everywhere and social unrest. But all is well. George W., I hope wherever you are in the world, you are staying safe. If you're in the States, you're staying safe. If you're in Europe, you're staying safe. If you're in Asia or South America, wherever you are in the world, or Australia, remember to stay safe, social distance. Coronavirus still very, very much out there. Make sure you're being extra cautious, washing your hands, social distance where need be. Kelly, thought I missed another premiere, but Dr. Sadek, she's in the house. Awesome. LJ Brunette, my 15-year-old daughter starting putting anti-dandruff shampoo of 1% ketoconazole on her face to treat acne. Okay? No, not okay. Acne is bacterial, it's hormonal. Ketoconazole is an antifungal. So it's there to treat ringworm, so it won't do any good washing her face in it, other than making a rather nasty rash. Belinda from the States, welcome. Joyce Clough from Lancashire, welcome. Watching the programs, awesome, awesome, awesome. Lovely to have UK watching as well as the United States and every other country in Europe. It's wonderful to have such a global community. I didn't see anything from Friday's premiere, says Kelly. I apologize for that. We had a technical issue. We were struggling to upload to YouTube. We've corrected that issue, and so we're going to get a video now 3 times a week. We just dropped one in the last week, but you know, with your support, we've managed to put on a lot of fantastic videos, a lot of live discussions, and that are going to continue as long as you guys want it. So as long as you're supporting and you're enjoying the material and encouraging it, then we're going to continue doing this wonderful work for the world. Deborah from Missouri, United States. Caroline Tomtom from Wales, welcome. Brazil, Basigio, welcome. Juliana Basigio, welcome from Brazil. Christy Rowlings from Washington, she's hoping everybody is fantastically well. Louise Cook, could you please comment on thyroid disease, particularly itchy, drying skin and sweating? Absolutely, we said we're going to do that. Missouri, how are you doing? Sindra Flynn from Ohio. Connecticut, Kelly. Marion, can surgery heal it? Ciao from Laura Marino, welcome from Italy. Denise Bond, welcome. Let's scroll straight through. Let's have a look. Donna Adams, hello from another lady in Oklahoma City. What happened to Friday's video? It never came through. Don't worry about Friday's video because Sunday has arrived and we've got a fantastic treat for you. So make sure you tune in. Cynthia Scott, welcome. Sharon Rodriguez, you need more info on thyroid disease. It's more prevalent than I thought. Okay, so everybody, there's a consensus that we want to cover thyroid disease. So I'm going to promise you, we're going to be doing that. We're going to cover hypothyroid, hypothyroid, thyroid antibodies, TSH, T4, T3, everything, goiters, you name it. We'll be covering thyroid, levothyroxine, all the different types of treatment. We're going to be covering thyroid on Wednesday, so make sure you stay tuned for thyroid disease. Please share the global virtual clinic on your Facebook and help your friends benefit from educational challenge. Absolutely, that's wonderful advice there from Sulalali. Question, what kind of facial treatments do you perform in your clinic? Well, my specialty is minor surgery, so I kind of keep it for the minor surgery stuff. But we do have some add-ons, some additional services, and that includes things like Botox and fillers and laser treatments and facial chemical peels and therapies and vitamin infusions. So we know all of that is in the clinic as well. So we've got a whole raft of treatments going on there. Caroline Tomtom, according to research I've done, psoriasis and diabetes have a battle with each other. Throw a dodgy thyroid in the mix and it doesn't look too cushy. Question, is gut health critical? Oh, Caroline Tomtom, gut health, absolutely critical. That is a whole topic by itself. And maybe if we do the Wednesday on the thyroid, we'll do the Friday on the gut health, because gut flora, gut microbiome, the symbiosis, the brain-gut theory, prebiotics, probiotics. There's so much to cover in that. Live cultures, lactobacillus, all of that kind of stuff certainly needs to be covered. Absolutely. So I will do that on the Friday. That's a big topic, Caroline. Thanks for pointing that out. So we're going to do thyroid and and gut as well. Salut from Milano, says Laura Milano. Welcome. Gail Sharp. I'm interested in discussing thyroid disease too. Awesome. Tina Babachuk from Ontario. Welcome via Swansea, Wales. Denise Bond. My sister had thyroid cancer. She had surgery and she's doing absolutely wonderful. Perfect. Quick fun for companies. Ancestry tracing. I think the best way to do it is just to ask your parents where they're from. The problem I have with companies that will tell you so-called ancestry tracing is that they will hold your genetic data. So they are building a global genome where your information is now owned by another company. So you're handing over your genetic data to a company, and they may give you a frivolous chart telling you that you're part American, part European, part African, but the sinister information behind it is that your genetic data, which will be correlated to your age and your gender and where you live, and maybe even certain diseases, will be owned by a corporation with the hope of mining that data for all sorts of things that are beyond your control. So that's my concern about handing over your genetic data to a corporation who is building a global genome for commercial use, and you're in effect handing over the blueprint, the essence of what you are, in exchange for a certificate. So just be careful about that. Read the small print. Radley Kramer from the United States. From South Africa. Welcome. Marion says, I've got osteoporosis and renal disease. Are they connected? Absolutely. Renal disease will precipitate osteoporosis. It will give you osteoporosis. So there's definitely a link there. South Africa, welcome. Stephanie Zimmerman, welcome. Kyra McCarthy from Mississippi. Heidi Radley, how are you doing? Isabel Vidal, 92 degrees, hot in Atlanta. Deborah, as if states are a mess. Can I move there? Of course you can. Heidi, how are you doing? Let's have a look. LJ Brudette, welcome. Welcome. Deborah, as if to get a knee replacement or not. Yeah, get the knee replacement, I always say. Jacqueline Robinson, listening from Australia, Queensland. I'm enjoying your videos. Keep up the good work. Awesome. Thank you so much for listening, Ms. Robinson. Let's have a look who else we got here. Sululali. Let's have a look. Missed the Friday video. A lot of people saying they're missing the Friday video. Apologize for that. It's going to come out today. Amber Million from Texas. Karen McCarthy. What are your thoughts on Botox for migraine headaches? Listen, migraine is very debilitating. If it works, works. What can I say? I've got dry skin around my nose. The dermatologist told me it was dandruff shampoo. Well, if it's fungus, then obviously that would work. But not. So a lot of questions about gut health. Heidi is saying gut health equals diet and food. Suggestions, please. Absolutely. So look, we're going to be covering thyroid disease on Wednesday, and on Friday we'll cover gut, and that will include special diets. So we'll look at food diaries. We'll look at something called low Fodmap diet. If you're not familiar with low Fodmap diet, it's to say like some of the IBD symptoms, so irritable bowel disease, maybe, or syndrome, maybe because of the fermentation of food in the gut, and there are certain foods that ferment more than others. And if you look at a low Fodmap diet, it'll put high Fodmap and low Fodmap foods into certain groups, and you can keep a diary and compare your symptoms accordingly. So we'll cover irritable bowel, we'll cover the inflammatory bowels of ulcerative colitis and Crohn's, we'll cover diet and disease, we'll cover drugs that improve your gut flora like metformin, and we'll look at probiotics, prebiotics, and we'll look at the gut-brain theory as well. So I hope that's all been very, very useful. Thank you all for joining, and we'll be covering thyroid as well. So don't forget, we're going to do live chat, global virtual live chat every Wednesday, Friday, and Sunday. That's the same time, 9:30 Greenwich Mean Time, followed straight away with a brand new pop. So let's crack on. Let's see this video. Hope you enjoy it. Till next time, everybody, take care. Bye-bye.